All new tonight, a Channel 2 Action News investigation revealed the state's efforts to crack down on fraud are putting thousands of disabled Georgians in jeopardy of losing critical services. One provider called the situation an insult to the disabled. That's how Nathaniel Miranda shows he's excited. He lives with staff member Tisha's help in this DeKalb County group home operated by Georgia Community Support and Solutions.
That would put us out of business.
Whitney Fuchs is CEO of the nonprofit, which operates 28 similar facilities in metro Atlanta. He says they all nearly closed after a state audit handed him a $1.5 million penalty.
This is not fraud. Services are delivered to people.
The state's Medicaid system pays for Nathaniel's care. A Channel 2 Action News investigation uncovered a state crackdown on Medicaid fraud is pushing facilities to their financial limits. Paperwork mistakes, like those at Fuchs facilities, are treated as serious infractions.
That makes me mad. We need to fix that.
State Representative Pat Gardner told me big penalties for small errors are jeopardizing facilities across Georgia. And penalties paid to the state are not earmarked for the disabled, but wind up in the state's general fund.
It's in nobody's interest to close down the good providers.
Earlier this month, I reported how the Griffin Area Resource Center in Spalding County is facing a $500,000 fine for paperwork errors. In some cases, the only mistake is the executive director wrote the wrong title after her name. The penalty could bankrupt the center.
There's nobody that wouldn't acknowledge that that is an inappropriate penalty for signing your name wrong.
Since I started investigating, the state has temporarily stopped demanding repayments and is reviewing the auditing process. A spokesperson told me the Department of Community Health is aware of concerns expressed by the state legislature and Georgia Medicaid providers and is conducting a thorough review.
These facilities will close.
Fuchs told me he settled with the state for a smaller penalty, but his staff took 20% pay cuts to cover the cost.
And it's a clawback from the state to get money that was paid for legitimate services back into the state's budget.
Now, meanwhile, more than 7,000 people in Georgia are on a waiting list for Medicaid services. A spokesperson for the Department of Community Health told me there's no estimate when that review of those audit policies will be finished.